Hello, my name is Jimena Ignacio, and I am a second-year undergraduate student at Oregon State University studying biohealth sciences. Today, I will be presenting about interval breast cancer, specifically among women's experience with diagnosis. Interval breast cancers are cancers diagnosed after a negative mammogram but before the patient's next scheduled screening mammogram. Interval breast cancers are more often larger in size, have more lymph node involvement, are of higher grade and later stage, and are associated with increased risk of breast cancer-specific mortality compared with screen-detected cancers. The objective of the study was to document women's entry into care through diagnosis. Specifically, we report the type of provider she reached out to, the wait time for diagnosis, and the reactions of the women during the diagnosis process. 44 women were eligible, and then there were 20 completed interviews. Individual in-depth interviews were completed using structured interview guide. They were all conducted via Zoom, and both English and Spanish language interviews were offered. However, we only were able to do English interviews. During the interviews, it was audio recorded and transcribed, and we were able to create a code book with structural and descriptive codes. The criteria for the interviews were for them to be female, age of screen between 40 to 69, did not have a breast cancer diagnosis prior to her first negative screen, a negative mammogram screen followed by breast cancer diagnosis before next screen within 2 years, and that all screening, diagnostic, and treatment services done within the same healthcare system, as well as their medical record from 2013 to present time. We were able to put together a pie chart, and we can see that the person who they contacted first the most out of the 20 women were their gynecologist, and their primary care physician, and radiology were the most with the woman who reached out to first, as well as an oncologist. And the wait time for diagnosis was that more than 90% of women state a short waiting time, which is under 6 weeks. Many state once diagnosed, their treatment moved quickly. The reactions from women during the diagnosis process were that some mentioned frustration with the process, some were satisfied with the smooth process, and many were shocked in general to hear about their diagnosis. One example from a participant of a quote she said was, "I was blessed with, I keep looking back and thinking, wow, it was amazing because I got in, I met my oncologist, we got going." In conclusion, we are able to say that most women reached out to a known provider. Most women were seen within a few days or weeks. Some women expressed frustration with delay of care because they wanted treatment sooner. Women were seen in a timely manner, and there is a good referral system among providers. We will continue coding to find more emerging things among all women who participated, and we hope to share our findings to propose additional training and resources to providers to shine more light on interval breast cancer.